Yes.
So now I invite Professor Ramesh C. Gupta sir and Professor Samantha will introduce him.
You all know Professor Ramesh Gupta, the GM of Uttar Pradesh. Professor Ramesh Gupta was heading the Department of Ophthalmology in many medical colleges in Uttar Pradesh. Right now, he is the principal as well as head of the Department of Ophthalmology of Government Medical College, Meerut. He was the first president of Uttar Pradesh State Ophthalmological Society, and as well as sometimes he worked as the Director of Medical Education of Department of Health and Welfare, Uttar Pradesh government. Welcome, Professor Ramesh Gupta.
Thank you, Dr. Samantha, for organizing this particular meeting. And I think it's very, very important because most of our previous speaker have almost covered everything in the UG and PG teaching in ophthalmology. So I wanted to give a broader aspect of medical education, not only concerning to ophthalmology, but in general. As we all know that it's a foundation of healthcare of any country. And of course, the quality of training motivated medical teachers, as we were discussing now, are of course is of the matter of concern. Therefore, it is very pertinent to attract and retain the best possible and motivated manpower for the training to produce the best. The trend recently we have seen actually because since we all are teachers and we are from 35 years in the field, and we are seeing that the trend of best students and scholars drastically reduced in number for opting the medical career, and continuously we are seeing that the standard is going down. And of course, as per observation and work experience, at present usually three categories of students are pursuing the MBBS courses. That is, the wards of the hospital are nursing home owners, the ward of rich business people and non-medical government servants, and actually motivated pursuing medical medicine is very, very less. Especially, I'm telling not for the premier institute, I'm telling for the common medical colleges. And the possible and evidence of this effect of the current challenges, that is standard medical students getting inferior because as madam was pointing out, that every time we are comparing from our time also and to this time also, and I think it is subsequent every year it's going down. The discipline, sincerity, diligence is also is a matter of concern. The motivation for selfless service is reduced drastically, and of course behavior. And because of that, the causes above, the behavior and soft communication has changed a lot. Then, due to effect, there is a continuous year-by-year deterioration of the standards of passing out doctors, doctor-patient relationship, communication with the patients and the relatives, patient satisfaction level, and comparison of incomparable facilities in terms of infrastructure, manpower, expenditure on disease management, resulting in violence against medical professionals, and of course, medical establishment and setting up a vicious cycle. Then the problems of medical education in this country is that if we see critically, with the competitive examination, first you prepare for the MBBS, then prepare for MDMS, then you prepare for MCH, and if you see all the totality, it takes about 13 to 15 years for a common person to pass out the MS examination, MSMD, and of course 80 to 20 years for MCH and DM, if we consider the bond in most of the places in the country right now. So because of this, actually the people, good scholars, they are not opting for the medical career. So so this is to be seen in the light of comparison with the other similar or equivalent or comparable careers in the other fields. So that is also a matter of concern. So obviously there is a huge difference in both valuables and disadvantages of numerous legal hassles, much lesser opportunities to work worldwide because of practicing license issues, deteriorating social respect, lesser monetary gain in general, ambit of Consumer Protection Act, criminal negligence resulting to jail, financial penalty amounting in crores, nexus of non-social elements, and nasty patient attendance leading to many unwanted activities, and most importantly, violence and manhandling by the society. So these are the matter of concerns which we all must, as a teacher, we must concern and we should think about. Ultimate result of all these makes the whole profession unlucrative in general for a common student. So if you see how the thing we go, or we all know, so I am not going in detail, that what are the various options after the passing out after MS examination or MBBS examination, everything, you've finished the course, you are at zero. And then you start that what are these are the various options like a private practice, government jobs, the private hospitals or medical colleges, corporate hospitals. So these are having different their advantages and disadvantages for each one of us. We all know that. Then after this, in government establishment especially, the poor infrastructure, frequent transfers, inappropriate and irrational remuneration, administrative political interferences, poor work culture lead to compromised professional satisfaction, and frustrations make the job unlucrative. These conditions are little better in government medical colleges, but are not up to the desirable extent. Then presently government established except for a few are not having backup departments of supporting services like maintenance, biomedical, engineering, IT, fire, safety, electrical safety, security, claim, horticulture, etc., which leads to additional unwarranted workload on teaching faculty that reflects the quality of attitude, clinical work, teaching, training, and research. Because we are making in our government medical college our faculty as in charges of all these segments, which are not their jobs. And if something happens, they are held responsible, and the government takes action on them. Then fulfilling all these norms are must, but this results in loss of lot of time, money, and harassment for starting up of your own setup. So these are the various other things which we have to consider. Society's unrealistic expectations, we all know that what doctors should do. Then broad suggestions and tentative solutions by making the change in existing system. These are problems I have narrated. Now we are coming that how we can go about it. Then MSR, especially for teachers, must be revisited, because when we see that how these made by the NMC, the small group discussion, self-learning, lot of things are given, but the requirement is decreased. So that is the problem, that only motivated medical personnel to be recruited as teachers, because now it is a job, because people are joining as a job, not as a teacher. So that is another point which is important, which this is one of the answer to Dr. Radhika, which was studying on. Then stress on self-learning should be more. Non-core competencies may be taught to put under self-learning category. These are the various solutions. Then my thought is that we have to go for radical change in medical education, and that is that MSR, especially for teachers, must be revisited. It is too less to implement the curriculum effectively. Only motivated medical personnel to be recruited as teachers, methodology in our country we have to develop. Then stress on self-learning should be more, and non-core competency may be thought to be put under self-learning category. This is my suggestion, that because if we have to compare with the other disciplines, comparable should be comparable, so that good students should come in the medicine, that 2 years of basic medical knowledge, then 1 year of clinical posting or internship under strict supervision of designated faculty mentor. Then during 1 year of clinical posting, evaluation for the interest and best suitability of the candidate for the broad specialty, preclinical, paraclinical, or clinical, medical or surgical. Then 3 years rigorous training in the respective broad specialty. And then for super specialty, if somebody wants, then he can have additional 3 years by entrance examination. So what will this will give? The advantage of this radical change will be that the talent would be attracted due to comparative curriculum time period, as in the other field approximately 6 years. Then unnecessary repetitions would automatically be avoided. Nation would get sufficient broad specialists in much lesser time. The frustration of not getting PG would be avoided. Also, now there is a practically very limited role or recognition of non-specialists in the society. So to fulfill the need of the general or family physicians, the required number of seats may be taken in the community medicine and family medicine. The significant monetary savings can be done, as only national stipend may be provided. The notional stipend may be provided during those 3 years of training for broad specialists instead of proper salary by junior doctors as per present thing. So